is Allison, and today I'm going to be going over AED training. An AED is an automated external defibrillator. This will help with any cardiac arrest, any cardiac distress, anything abnormally going on with the rhythm of your heart. I would use this on any emergency coming up to a patient or a bystander that has fallen unconscious or is having heart problems or symptoms. I would, if they are unconscious, I would check for breathing, check their airway, circulation. I would make sure that the area, the scene was clear. And at this point, if I did determine unconsciousness and there was no pulse or breathing, I would start CPR, and I would instruct someone else to go and call 911 and get me an AED for this. After the AED comes and I've already started my CPR, I would turn on the AED. It's very simple. I would push the power button, and it will take me through step by step if I was someone who wasn't familiar with it or needed some refreshing. It tells me step by step what to do. So I would turn it on, and first it would instruct me to clear the area. So I would cut the shirt or the clothing, whatever they're wearing, and I would make sure that the area was clear. Next, I would place the pads on the body. They are labeled to where the pads need to go. So the first one would go the upper right quadrant right here, and then the second one would come lower left, right below. So after this, I would make sure that the area is clear, making sure that no one is touching the body. At this point, the AED will send signals to detect any possible distress or any abnormal beats. If it did detect that there wasn't any rhythms or abnormal rhythms, it would tell me to administer the shock. If not, it would tell me to continue CPR, and it would after I would do the 30 compressions, 2 breaths, it would reassess the body to make sure that the heart was still going. If not, I would administer the shock. Some precautions to use or to look for are making sure that if the body is or the patient is wet out of a swimming pool or rain, we need to make sure that they are in a dry area, making sure that they are dry, possibly placing a towel underneath them so there isn't a pool of water underneath them. We need to make sure that we don't clean the area with alcohol, that it is flammable, so we just need to make sure that that doesn't occur. If it is a male and they have hair on their chest, typically the AED comes with a razor, and we would shave the area to make sure that the pads stick to the body. We just need to make sure that everyone is clear, that there's that no one is touching the victim, to make sure that the signal can be read. After this, then we would obviously we would have already called 911, and they would be in the process. At this point, it is important to make sure that any emergency action plan is practiced and is continually reviewed to make sure that we know all course of actions and any route the route for EMS to arrive. It is important to remember the steps to take in case of an emergency. And it is important to make sure that you know where any AED is at any location that you're at, either at a practice field or a school or any setting that you are, making sure that you know the designated areas for it. Thank you for watching. Hope this video has been informative and will possibly help you through an emergency situation. Thank you.